And then I use a lot of process resistance techniques with patients, like dangling the carrot, the gentle ultimatum, sitting with open hands, and also what I call the fallback position. And these are techniques now for process resistance, not for outcome resistance. We'll deal with those techniques as well. But dangling the carrot conveys a sense of hope. And whenever you want someone to do something hard, they have to have some motivation. And so dangling the carrot means conveying a strong sense of hope, and that there's an exciting outcome to therapy that's a high likelihood probability. And so the carrot is a hook that can serve to motivate the patient. So you can say something like, I'd love to help you with your social anxiety, and I have some really powerful tools to share with you, and I think we can do some great work together so you'll feel way more comfortable in social situations. However, there are some things you're going to have to do to change. It's not going to come through magic or by talking or by exploring your past. And you need to be clear in your own mind what is required for the patient to recover, and you have to deliver the message with warmth and empathy. So the gentle ultimatum, which comes after dangling the carrot, you might say something like this: Priya, it sounds like you really want help with your social anxiety. I'd love to work with you on this, and I think we can do some great work together. I have lots of cool techniques that you're going to love, but there's one technique, exposure, that you're really going to hate at first. In my experience, exposure is extremely effective and even necessary, but it requires courage on your part, both in sessions and out of sessions. Of course, I'll be there with you every step of the way. Are you willing to confront your fears with my help if I agree to work with you? So notice we're not trying to persuade them. We're really trying to say, if we work together, this would be one of the things that I'd be using. And other ways you can say it is, if I agreed to help you overcome your social anxiety, would you be willing to face your fears, even if it feels incredibly uncomfortable at first? Or I'd love to help you overcome your social anxiety and so you can feel at ease with people. And I believe we could be very successful, and it could be life-changing for you. And you deserve to have the chance to get close to people and to have friends and loving relationships. But I just don't know how to eliminate any form of anxiety without confronting that fear. Are you willing to do this kind of work with me? So we're asking the patient. And if the patient does not want to use exposure, then I would have a fallback position, which would be something like, if you don't want to use exposure, I can totally understand, but at the same time, I have to let you know that I can't treat your social anxiety or any form of anxiety effectively without exposure. Now, if you want treatment without exposure, there are many therapists in the community who, like yourself, don't believe in the value of it or necessity of exposure techniques. I don't know how to treat anxiety without it, but I'm sure any of those therapists would be delighted to have you as a patient. And then if it didn't work out and you changed your mind, you'd always be welcome to come back and work with me. Or you could say, I love working with you, and while I can't agree to treat your social anxiety without exposure, maybe there's some other problem that we could work on together. And this willingness to sit with open hands is incredibly critical to the success of the therapy. And that will require for many of you as therapists, a change in your own philosophy, and sometimes the therapist has to change before the patient changes. And what I mean specifically is you may think that if you're nice enough and kind enough, eventually the patient will, get the courage to do what they have to do to change. But that hasn't been true in my experience. And the gentle ultimatum, the dangling the carrot and the gentle ultimatum, and then the fallback position are pretty absolutely critical to therapeutic success.